Today, a surprising new study suggests that daily low-dose aspirin may help reduce the risk of cancer in certain older adults. But it all depends on your genetics and other health factors. The research published in JAMA Oncology found that a condition known as clonal hematopoiesis of indeterminate potential, or CHIP, that's a lot easier to say, was the strongest predictor of whether daily low-dose aspirin might help prevent cancer. Now, CHIP refers to a genetic mutation in certain blood cells that becomes more common with aging. People with CHIP already have a slightly higher risk of developing blood cancers and other health issues, but this study suggests that for those individuals, aspirin could actually be protective. The findings come from a secondary analysis of the aspirin in reducing events in the elderly, or the Aspirin trial, and its follow-up, the Aspirin-CHIP sub-study. The Aspirin trial included more than 9,000 healthy older adults with a median age of 73. Hey, who's saying older? Who took either 100 milligrams of aspirin daily or a placebo for about 4.5 years. Now, the original trial, researchers saw no difference in the overall cancer rates between the two groups. But when scientists factored in CHIP status, a fascinating pattern emerged. The researchers developed an effect score model, basically a predictive tool to determine who might benefit most from aspirin therapy. Here's what they found. For some adults, the model predicted up to a 21% reduction in 5-year cancer risk. But for others, aspirin could actually increase their risk by as much as 23%. That's a wide range, and it shows why personalized medicine is becoming essential in cancer prevention. In the treatment-favorable group, low-dose aspirin users were older adults with higher hemoglobin levels and a family history of cancer, and importantly, CHIP detected at a variant allele frequency of 10% or greater. For this group, aspirin was linked to a modest but meaningful reduction in cancer risk, with a hazard ratio of 0.85, just reaching statistical significance. In contrast, the treatment unfavorable group included participants who were current smokers, had higher body mass index, diabetes, polypharmacy, or a personal history of cancer. For them, aspirin appeared to increase their risk, showing a hazard ratio of 1.14. The study's lead authors highlighted two main takeaways. 1. Current smoking factors tied to harmful effects of aspirin. And 2, CHIP was the strongest predictor of a beneficial effect, followed by age and family history of cancer. Among aspirin users, those predicted to benefit had a lower 5-year cancer risk, 10% versus 13%, compared to those who were predicted to experience harm. So what does this all mean for you or your patients? The researchers concluded that there's no one-size-fits-all answer when it comes to aspirin for cancer prevention. Instead, the key lies in personalized treatment decisions, taking into account genetic factors like CHIP, lifestyle risks such as smoking, and an individual medical history. They emphasize that more research is needed before making recommendations. And of course, no one should start or stop daily aspirin without first talking to their healthcare provider. Hey, tomorrow on UroNurse, I sit down with Dr. Landon Trost, a leading urologist in Peyronie's disease research, to discuss a groundbreaking new tool in men's health, the Peyronie's gene. This cutting-edge genetic test could change the way we understand, predict, and personalize treatment for Peyronie's disease and other sexual health conditions. So, hey, don't miss this insightful look into the future of precision medicine for men's sexual health, only on UroNurse, uronurse.com. I'm Vic Senese. Thanks for watching. Be sure to like and subscribe, and hey, tune in next week for more stories.